Thank you, Mr. Chairman, and thank you, Administrator Tavenner, for being here and all the work you're putting into this. When we passed the Affordable Care Act, we really designed it to have states lead the way and drive market reforms by building their own marketplaces. States like Kentucky and my home state of Washington planned and designed and created their own marketplaces. And of course, many states declined the opportunity to build their own marketplace and relied on the federal government to do the work for them. Washington State's Health Plan Finder has been really a national leader on the launch of their new marketplaces, and in its first month enrolled nearly 55,000 people from my state for new health insurance coverage, including 10,000 kids. So I'm very proud of the work that's been done in my state to provide access to quality, affordable coverage. And I wanted to ask you to tell us a little bit about what you are seeing in the states like mine that develop their own marketplaces.
Well, you certainly listed some of the top. Certainly, I'll just list a few. All the states are working hard. You know, we have 17 partners at the state level, including D.C., and I would say that what we're seeing in Washington and Kentucky is probably some of the strongest performance, which is great. They have good systems. They've had lots of application interest. The other area that I would say we're pleased with, because of the size of the states, they're so important, is New York and California, where we're seeing good progress. But each of the states are moving along, and part of what we will be submitting in mid-November, as I've talked about in previous hearings, is some information about applications and enrollments that will look at the state and what's inside the state as well as the federal marketplace. So we'll have more data for you.
Good, and we're going to be using some of those states to use their best practices to help.
We are indeed. We have a meeting with them this Thursday. We meet with them regularly.
Good.
We have a good relationship.
Okay. And I also wanted to ask you about the next round of outreach to Americans and what it will look like. Everybody's focused a lot on the website, and we all know it's improving, and those will be solved. Those issues will be solved. But obviously, a lot of Americans were frustrated by their initial applications, and we've got them to get them to return to the site, the crisis of confidence that Senator Mikulski talked about. But in addition to those people, I want to know about the administration's plan to reach out to those Americans whose individually purchased plans are being canceled by their insurance companies. There was a story in our paper in Seattle about a 56-year-old woman who received one of those cancellation notices and who, like a lot of other people, was told to blame the Affordable Care Act in that letter. But of course, she wasn't told that if she accessed the ACA marketplace, it could save her and her family thousands of dollars and provide her with upgraded, more comprehensive health care coverage. As I read her story, I thought that's an important reminder that it's going to be an uphill battle against some political and industry interest to get those individuals good information that have received those letters. And I wanted to know what you are doing to get information out to those people whose policies have been canceled that we've been hearing about.
This is actually a conversation we're having today about how do we use that. We have a consumer assistance program within CMS, within the SOCIO component. Is there a way we can actively engage to reach out to people who have been canceled? Although they're canceled, they are offered another policy, but I think what's important for them to understand is it's not just that policy, it's also the ability to go on the exchange. As you mentioned in Washington State, they don't even have to apply, they can go take a look at what the rates are. You can now do that on the federal exchange as well. So we are working on a plan, and I'm happy to get back to you on that, but it will get back to you like this week.
Okay, I think that's really important because a lot of them are just seeing your policy's been canceled by Obamacare and not being told here is what your options are, and we've got to really work on that. So I appreciate that. Thank you, Mr. Chairman.